It used to be that I was traumatized by the dentist. I was terrified to go. The sound of the drill, the smell of the teeth. I would get so scared before an appointment that I would stay up the night before. I would cancel over and over again, and then inevitably everything would get worse. So going to the dentist would be even more painful and scary, and it was just a bad cycle. But then everything changed. I met Dr. Siegelman.
I'm Dr. Lou Siegelman. My office is dedicated to helping people who have trouble going to the dentist. The people who come into this practice often have had traumatic experiences in their past, and this can impact greatly on their comfort in the dental office. They may feel anxious leaning back, they may have a sensitive gag reflex, the local anesthetic may not be completely effective for them. So all these things can play a role in making people less comfortable with the dentist. And this becomes a burden for them over time, and I can help them lift that burden.
Dr. Siegelman is a different type of dentist. He treats his patients with respect. Everything is explained to me in great detail. When I did my cavities here with Dr. Siegelman, it was quite literally painless. I didn't feel a thing. It didn't seem possible that you could actually go to the dentist and have cavities filled and not feel a thing. But it's true. I didn't even feel the numbing. It was so carefully done, so thoughtfully done. I wasn't scared about it, which I can confidently say I never thought that would ever happen at the dentist.
With our technology, we can make the patient experience a more comfortable one.
Technology plays an immense role in the provision of this kind of dental care, because more than ever I can be very efficient, provide great quality, and create great results in a fairly short period of time. Some of the options for getting dental care comfortably could be intravenous sedation, it could just be a Xanax, it could be just somebody hearing what you're really about and what your real needs are. Sometimes just really listening to the patient and tuning into them is really enough to help people gain the confidence to have their dental care done. We have a lot of neurodiverse patients, and there's so many things that we could do for them. The neurodiverse community, they're very sensitive to sights, sounds. These things can be very caustic to them, and they're very aversive to that. And I could design a treatment plan that works around those things and helps them get their dental care comfortably.
When patients come in for the first time, they're usually very anxious and often need sedation. After a few visits with Dr. Siegelman, they're totally relaxed, they're different people, and quite often they don't need sedation anymore.
Now when I go to the dentist, it's easy. I don't even think about it. It's like going to the hair salon. It's an easy thing to do. It's wonderful. Everyone is so kind and welcoming, and I'm in and out. It's an easy peasy thing, and I don't mind it at all. In fact, I even look forward to it.
It's very evident the difference that could be made in people's lives. And people will say, this has been life-changing for me. And I know what they mean is that they've been able to form relationships, they've been able to go out and get a job, they've been able to live their life more fully and completely because they no longer bear this burden, this daily burden of worrying about their mouth and their smile and their teeth and their health. Experience the softer side of dentistry. Call for an appointment.